Welcome back, everyone. Dr. Linda here, AMP1. We are going to talk about planes. When we talk about planes, what I mean by that is being able to divide the body into different directions. Like if we look at this section right here, this cut of the body in this direction can separate the body into a left half and a right half. And this plane is referred to as a sagittal plane. Okay? Now we have another cut that goes this way, separating the body into an anterior portion and a posterior portion, like we see here. And we call that either the frontal plane or the coronal plane. I like coronal because when you study osteology and you look at the skull, on top of the skull, there's a sagittal suture and a coronal suture. So it could be coronal, which separates into an anterior or front half and back half. And then there's a sagittal suture or sagittal plane that separates into a right and left half. Then the last plane, or not the last, but the third important one, is called a transverse plane. That cuts the body into an upper and lower portion, or upper and lower half, giving us a bird's eye view looking down into the body. Okay, now why is this important? It's important because when we do diagnostic imaging, whether it's an MRI, PET scan, CT scan, we can do them in slices, looking at the body in different planes, so we can tell just how big a tumor may be, or a mass may be, or did it invade or metastasize into other bodily tissues. So on a quiz or a test, if you saw something like this, this is the transverse plane separating into an upper and lower half. Here's an MRI looking at, well, here's the brain, here is the frontal lobe of the brain, and here is the occipital lobe, and here's up here is the parietal lobe of the brain, and then here's the cerebellum, here's the pons, here's the medulla, here's your tongue, here's your nose, here's your spinal cord, these are your intervertebral discs here. So in this slice, we're looking at half. We're looking at a left half or a right half of the body. That's a sagittal cut. This one here is a transverse cut. We're looking bird's eye view looking down, and these are the ventricles, so we can see cerebral spinal fluid here and here. So this is looking at like a bird's eye view looking down into something. Now this is separating to a front and back half, so this is the left side and this is the person's right. This is separating them in half. So this is your coronal suture or frontal, right? Your coronal plane or frontal plane. So drag and drop. Okay, what divides the body into an anterior and posterior section? You would drag the term coronal there. Or what divides the body into equal left and right halves? Now, if you look at equal compared to unequal, if we're talking about equal, it's right in the mid. It's still a sagittal cut, right? Sagittal is left and right halves. But when we talk about equal halves, it's mid-sagittal. If it's unequal left and right halves, it's para-sagittal. And your transverse section is just superior and inferior sections. That gives you that bird's eye view. Okay, now, this is tricky. Some people may jump and go, oh, right lower quadrant. But it's asking here, what is the medial border of the highlighted region? So here's the highlighted region. This is lateral. This is medial. This is superior. And this is inferior. So it's asking about the medial border. So what is this? This happens to be mid-sagittal. This is a mid-sagittal plane right here. It separates into an equal right and left half. Okay, now you may jump to this and go, ooh, I know this is the left hypochondriac, right? This is the umbilical, this is the epigastric, the hypogastric, or pubic. This is the left flank or left lumbar, and you'd think right flank or right lumbar. Okay, but look what it's asking. What is the name of the line that makes the medial border of the highlighted section? So again, here's inferior, here's superior, here's lateral. This is the medial. If we follow it up, right there, it goes to the middle of the clavicle. And I didn't give you the choices here, but the best choice is mid-clavicular. It's these lines here, this one is called a mid-clavicular line, and that's a mid-clavicular line. Okay, we'll take a break here and we'll finish up with one last video.